No, really appreciate you guys coming out. We're going to talk about a topic that has not come up at all during the conference so far. So this is another one on AI. But I think that...
I'm in the wrong place.
Yeah, no. Yeah, so John has to leave quickly. But I think so. We've had a number of sessions on different concepts of using AI, scaling AI, thinking of ROI, showcasing it to your CFO or other audiences. So we're trying to think about how we could get the most out of this session to give you sort of a more tactical view and a more sort of like, what do you do next if you want to embrace this? So as we thought and as we discussed this as sort of a group as to what to showcase on the panel, we thought we'd probably explore kind of three main questions. For groups that are starting to add AI to workflows or implement AI-based tools within their organizations, what are the areas you're actually doing it tactically, and where are you thinking of going next? So that's one area we want to sort of start to explore. From there, we'll transition to, okay, so you want to do something, how do you get started? What are some of the experience or scars you've seen sort of trying to get going? Or on the opposite, what are the things that have helped you get going? So that'll be sort of number two. And then number three is, give us an example. Tell us a little bit about one of the experiences you've had with a project or pilot that you're looking to get launched that includes AI in some way. And that's a pretty broad purview, so we'll try and get a few examples. I'm also going to look out in the audience and see if some of you guys have examples you'd like to tell us about. Because I think we're all as a community, everyone's talking about how do you quickly deploy AI and get to a point where there's immediate ROI. And everyone skipped the fact that almost no one's done much of it at all so far. There's not a whole lot of playbooks out there. There's not a lot of scars that we can learn from. And so we're all mostly starting, acknowledging that as we start today. And our goal here is to walk away with, maybe here are the areas you should think about looking at adding AI within your health systems or organizations. Here are some of the places others have got stuck. And here are some examples of what has started to work or what is going to be proved out over the coming months. Cool. We're a pretty collaborative group. I know it's hard to shout out questions, but if you have a really good one, feel free. And let's go ahead and get started. But before we jump into the topic, maybe a brief intro from each of you on who you are, your organization, and I'll let you take it away.
Yeah, good morning. I emailed Andre right away when I was asked to be on this panel because it said successful in the title, and I was pretty sure they chose the wrong person for that. I'm Amanda Benites. I'm the Director of Quality for Prisma Health in the ambulatory space, and I support our value-based care efforts through the Envio Health Network. We have a footprint in South Carolina and Eastern Tennessee. And I'm looking forward to hearing just practically how people actually dive into this with all the barriers and constraints.
Great. Good morning as well. John Supra. I'm the Chief Digital Health and Analytics Officer with Cone Health. We're an integrated delivery system in central North Carolina, and we have about 200,000 lives under various risk arrangements, Medicare, Medicaid, and commercial, and we are part of Rising Health, the second Rising Health. We refer to them as RHOs, or Rising Health Organizations, along with Geisinger, and is part of the Kaiser family.
I'm Dr. Carolyn Wong-Simpkins. I'm an internal medicine physician by background, and actually my first job out of practice was at one of the predecessor hospitals to Prisma. And I now am the president of a company called Zynx Health. Unlike most of the companies I think that any of you have heard about or interacted with within this space, Zynx has been around for 30 years. We've been managing the knowledge base to embed into the electronic workflow to facilitate better outcomes and better health care. For all this time, now, starting in the hospital with order sets, now spanning the entire spectrum of the patient journey and all the different providers. Perhaps in the future will also be patient-facing, but haven't quite gotten there yet. Yeah, I'm really excited to have this conversation. I would agree with Amanda in our sort of prep session discussion. I think we're all on the same page that we're still learning the lessons as we go, but it's moving very fast. So this is an important conversation to have.
Very much agree. And I'm Andrew Diaz. I lead customer success for our East, West, and government accounts. And I won't tell you about Innovacer because hopefully by now you guys have heard something about us and know who we are. So maybe let's kick it off on that first topic. And John, I know that, so when we're doing sort of the discussion prep for this call, you sort of laid out 5 categories of, here are the different places I could envision AI being added within the workflows of my health system. Maybe talk the audience through what those 5 categories are, and would love to get some reactions on whether they resonate with you both.
Yeah, and I was going to actually extend to the audience as well, and I'm going to add an extra bonus concept to this
As
based
you
on
often
what
do.
you said earlier. So as Andre said, as we were doing some prep as a group, just trying to, how do you start talk about, and this conversation has been, well, what's success? Everyone wants fast ROI. This is a long game. The impact on AI is going to take a long time in some areas to be realized, and we're looking at realization very quickly. So we sort of like, how do you even start to group these? We came up with these 5 areas, and they may make sense, they may not. So one of them is everything going on in our just day-to-day work. So all the work that's happening, correspondence, documents, just having quicker answers by using whatever GPTs you may have. Many health systems are M365 customers, integration with Copilot. So all of these things that just accelerate the work that you were doing yesterday. We don't even talk about a lot of those because we jump all the way to things like workflow. Another area, and you heard a little bit about the team, the Rise It and Cone team, in our rev cycle and prior auth. So there's a lot going on there. It's an area where we have a tremendous amount of labor, a tremendous amount of technology, and moving faster is important there. So there's probably a whole pathway in the rev cycle and finance world. And then we started to think about what do we do and how do you group these together? And there's a whole bunch of provider facing, direct care delivery, indirect provider support and ambient listening and other tools, and really wanting to give our providers an amazing experience. Providers, our clinical staff, our practice staff, everybody that is delivering direct patient care, either in person, virtually, or otherwise. And then coming back to the patient, consumer, community, member experience. And how does that change? And these interact with each other. And then finally, we spent a lot of time talking about the power of analytics and the data that is underlying all of this. There's a lot going on the data and analytics side. We can say is AI enhanced. Thinking about how do we improve the speed to deliver insight to either the workflows or building the workflows. So we ended up with these 5 categories. And I'm going to add this new thread that I was thinking about just as Andre was talking. And in each of those, we touched on this a little yesterday, is I was thinking about a book. Has anyone ever heard of the book called The 3-Box Solution?
I've not read it. I read the preface, but I've heard of it.
He's heard of it. So this is a book, VJ in a very long last name that I will not. So find 3-Box Solution if you want. But the premise of the 3-Box Solution is, if you are involved in innovation, transformation, and you have an existing business, you've got innovation happening incrementally on today's business and the way you do it. And I think about prior auth, the revs, that's becoming more efficient in today's business. And then you've got to be very intentional on what you're going to give up. What should you not be doing? And what in these cases, in this context, will AI allow you to do differently? And then lastly, what is fundamental transformation? That either without AI in this case, technology, different thinking, a different financing model, a different reimbursement model, you couldn't do differently. And if you don't think intentionally about those different boxes, we often ask our most talented leaders to try to do all of them at the same time. And I think we're doing that in AI. We're not stepping back and going, are we making this process more efficient in today's world? Should we really be doing this any longer? And in that case, I'm going to save it till the end. You said what hasn't gone well at the end? I'm going to save that one till the end. And then in transformation, how are we stepping away and taking the time to say, how can this be radically different? So it's these 5 areas now married with 3 ways to look at those areas. So that's a matrix of 15, and I'll pause there. So, how about thoughts on
Actually,
that?
a couple of thoughts on that. From the group, anyone have from the group, anybody have a use case that doesn't fall one of those 5 areas that you want to shout out? You're like, not
That's a
captured
great
in any of
question.
those. Silent.
You're so thorough that
Well, no, think about it. You get to shout out at any time.
think
We'll
about it. We
pause
can come up with
we'll pause for that question again. But if you have a use case where you're like, I've been thinking of applying to AI, and it doesn't fall in one of those 5 buckets, we want to know, because we want to think as a group how we think of segmenting this problem into different spaces of innovation. But
I'll mention a little ADD. Can we recap the 5 buckets?
yes,
We need a dynamic slide. Who's making?
we might make
Do
a
you
slide
have
on
one, or
this,
you
but
want
I
me to
think,
do it?
go ahead, sorry.
So I started with, and these may not be the right ones. This is the challenge. In basic administrative work, sending emails, automations that, your co-pilot, your chat GPT, choose your research with Claude or coding support, rev cycle, finance, all the things that go there, provider facing support, meaning essentially clinical operations or practice, including virtual, the patient's experience, the other side of that, be it making an appointment, how you get into the system, locating, and then support for how to use AI to improve data cleansing, to make analytics access faster, and to power these workflows. So that's what we have.
But we'll come back with that question as
I
folks
like that
have time to ponder it. Dr. Wong-Simpkins, I think when we talked, most folks are sticking in that first administrative work. Then you have some folks taking a stab at revenue cycle, us included. I think that sort of like getting deeply into the direct clinical impact is one that's further down the line, but companies like yours with like a more of a specialty focus have the ability to do that. Talk to me about how you're working on that, how quickly those things are coming up, and what are some of the things to consider as we think about innovation in that space.
There are a number of really interesting things to talk about there, but I will try to keep it short. Because of who we are at Zynx, we are really skipping ahead and going against conventional wisdom and identifying and tackling complex problems. More than half of us, like myself, used to take care of patients. And we have built this, well, even prior to me joining, the business has been built on a deep well of subject matter expertise in clinical practice. So more than half of us are doctors, nurses, pharmacists, used to take care of patients. We remember what the struggle was, and we very much, all of us are driven to leverage whatever technology emerges, whatever methodologies we can bring to bear at Zynx to make the complex things happen more easily. So we are identifying very complex, challenging tasks that need to be accomplished across the clinical spectrum, and then using the tools available now to make it easy to accomplish those tasks. So I'll give you an example of a clinical task, and hopefully there's enough clinical people in the room that this will resonate. So one of the tasks that we have built an embedded workflow tool for is identifying when someone has resistant hypertension and identifying what the next steps are, but only flagging that up when those conditions are met. So the challenge is, I'm in primary care practice, you have 15 minutes at best with a patient, and you're dealing with whatever they caused them to come in today, and taking the time to look back through their record and see how long they've been on optimal, check whether they're on optimal doses of their hypertension therapy, and then going back through time to see how many times their blood pressure has been above goal during the time they've been on that. This is a huge task in the medical record. And so pulling all of that out in an automated fashion, applying the logic, and then surfacing it for the clinician at the point of care, it would help the clinician to do something they know they need to do, but to do it so much more easily in that 15 minutes or less of the visit. We have a similar use case for stroke. We have a similar use case for CKD, which is another chronic condition which requires sort of assessing the data on the patient over time, which it's all there in the record, and that's where we're getting it. But actually bringing it together with the guidelines and the evidence and what you should be doing in order to take that cognitive burden off the physician and help them to accomplish these sort of improvements to the care and ultimately better outcomes for the patient. Those are the types of sticky problems that we're tackling because of who we are. So we're skipping ahead from the simple to the complex, because that's where we think we can add value, and that's where we think as former clinicians, where we would have needed the help. We didn't need help with the simple things. Those can all sit in your head. We need to help with the complicated things.
On that, so maybe a follow-up on that, and also others feel free to interrupt, but you mentioned taking away the cognitive burden. And I think the reason folks are probably avoiding that third category of direct care a little bit is that they worry is that if you take away the cognitive burden, you'll take away the cognitive decision as well. And so they're sort of almost worried that where do I become like a suggestion versus I'm
Right.
informing the decision and perhaps taking away somebody thinking about it. How do you guys think about that as a company? Because you're probably facing that
Right.
head on.
Well, I mean, there's some medical legal ways that we think about that, but
Outside of the
but that
software medical
aside,
device
Yeah.
world.
that aside, there are many things not captured in sort of the hard data of the medical record
Mhm.
that you need to take into account when you're practicing, when you're working with a specific patient. And so everything that we design is designed as suggestions. So we're trying to assemble all the data across really complex use cases and surface it at the moment when you could do something about it. But then we're leaving it always to the clinician. Now we make it as easy as possible